Is this something I have to live with forever? Fertility is truly a team effort. Early evaluation creates options, and options create hope. When couples face fertility challenges, the first check usually focuses on the woman. But nearly 50% of the time, the issue could be with the male partner. Hi, I'm Dr. Karthikeyan, andrologist and urologist, and in this video, we'll uncover why male infertility deserves attention from the very first. Let's start with the fact that surprises many couples. Male infertility is far more common than people realize. I often see men with low sperm counts, no sperm at all, what we call as azoospermia, or an untreated varicocele. These conditions are far more common than most people expect. The important thing to understand is this: male infertility is not rare, it is just under recognized. And the good news is, most of these problems can be properly diagnosed and many can be treated, especially when evaluation isn't delayed. Fertility is a shared journey. Getting tested is not a sign of weakness, it is a responsible first step. Once we understand how common male infertility is, the next question is, what does testing actually involve? If you are wondering what fertility testing actually involves, let me simplify it. For men, evaluation usually starts with something very basic, a semen analysis. This test gives us key information about sperm count, movement, and structure. If needed, we may then look deeper. Hormone levels, an ultrasound to check for varicocele, or genetic tests in specific cases. None of this is painful, and most of it doesn't require hospital admission. What truly matters is the timing. The earlier we identify the cause, the more options we usually have. There is a lot of unnecessary fear around fertility reports, and it often comes from misunderstanding them. When men see a semen analysis, they tend to focus on a single number. But fertility is never about just one parameter. A low count doesn't automatically mean infertility. Poor movement or abnormal shape can affect chances just as much. That's why interpretation matters. Two men can have similar reports but need very different treatment plans. So, a report isn't a verdict, it is a guide to help decide the next step together. So, what happens if your report doesn't look normal? The first thing I tell my patients is don't panic. A single report never tells the full story. Once we understand what's affecting the results, the treatment is usually very focused. If there is a varicocele, treating it can improve sperm quality. If we find the hormones are imbalanced, we can correct them. And in many cases, simple lifestyle changes like improving sleep, managing stress, addressing weight, or quitting smoking, they all can have a real impact on your sperm health. Treatment isn't always complicated. It is about understanding your report and choosing the right next step for you. Now, the very important question: do all fertility problems need surgery? No. And that's important to understand. Surgery is recommended only in selected situations. For example, when a significant varicocele is clearly affecting the sperm quality, or when there is blockage preventing sperm from being released normally. In the right cases, these procedures are actually safe and purposeful. They may improve the chances of natural conception or support the assisted fertility treatments whenever necessary. So, surgery is never the starting point. A clear diagnosis always comes first. Now, beyond reports and treatments, there are questions men often hesitate to ask. Most men don't say this out loud. They wait until the end of the consultation and then ask quietly, did I do something wrong? Will treatment change who I am? Is this something I have to live with forever? Let me reassure you. These fears are very real and very common. However, fertility issues are medical conditions. They are not a measure of your strength, identity, or masculinity, and in many cases, they are treatable. If you are trying to conceive, here is something very important for both of you to hear together. Fertility is truly a team effort. When both partners get evaluated early, we find the real cause faster, avoid unnecessary treatments, and reduce stress along the way. It gives you clarity, confidence, and hope, not just as individuals, but as a couple. So, my dear viewers, think of fertility as a shared journey, not a burden carried by one person. Progress comes when you move forward together, informed and supported. Early evaluation creates options, and options create hope.